That is the viral keratitis. Okay, and it is caused by herpes simplex virus. Only the herpes viruses affect the cornea. Most of the other viruses don't. So it can affect the cornea in two different types. It can be only an epithelial keratitis, or it can go deep into the stroma and cause a stromal keratitis. Okay, so epithelial and stromal HSV keratitis is present in cornea. The epithelial keratitis is characterized by dendritic ulcers. Please don't forget this word in your questions. You see the word dendrite, that is a true dendrite. See, we had seen a pseudodendrite in acanthamoeba. So, the dendrites that occur in viral keratitis are called true dendrites. Look at this picture, such beautiful dendrites you can see. Branching pattern of the ulcer. So, this branching pattern of the ulcer, like this, or say it's like this, okay. This branching dendritic ulcer further progresses into a geographical ulcer. That is, most of it becomes like the map of a country, then ultimately resulting in loss of corneal sensation. This is an important clinical feature. Okay, what you can do is, whenever you suspect a viral corneal ulcer, you can just touch the patient's cornea with a wisp of cotton. In the normal eye, the corneal sensations will be preserved. He will blink his eye. However, this is absent in the eye with the herpes keratitis. Okay. And there are two types of keratitis that I would like to share with you now. The first one is the neuroparalytic keratitis. As the name suggests, it occurs due to the palsy of 7th nerve. Okay, try to remember here. 7th nerve is neuroparalytic. So what happens here is, it is a kind of an exposure keratitis. That is, the cornea is exposed to the external environment because why is it exposed? Because the facial nerve, that is the 7th nerve, supplies the orbicularis. And we have learnt earlier that orbicularis is the only muscle that closes the eye. So now when the lid that closes the eye is paralyzed, obviously the cornea is exposed to the environment, causing exposure keratitis. This is termed as neuroparalytic keratitis. It is 7th nerve palsy. Okay. Now another condition similar to this but much different is neurotrophic keratitis, and this is due to your 5th cranial nerve palsy. 5th nerve palsy. Okay. It is called neurotrophic keratitis. That is trigeminal nerve. Now these two can be getting confusing in your exam. So I would like to give you an easy way to remember. See, T is present in trigeminal nerve and neurotrophic as well. So trigeminal, trophic, TR, both TR, trigeminal, trophic. So neurotrophic due to trigeminal, that is 5th cranial nerve palsy. We know that the 5th cranial nerve carries sensations to the cornea. So this is lost in this keratitis. So what happens is, the patient cannot feel anything even if you if there is a foreign body on his cornea. He does not realize that it is present, and it is present in there impinged for a very long duration, ultimately resulting in a corneal ulcer. That is about neuroparalytic and neurotrophic keratitis. Now let's go deeper and look at the stromal keratitis caused by the herpes virus. So you can see in this picture, so the stroma is very hazy all over here. Okay, it forms a disc of edema over here, and it is, we have discussed just now, a herpetic stromal ulcer. Now what you have to understand over here, it is not an infective condition. It is not infective, it is an immunological reaction of the body. Okay, it is an immune response towards the infection that is causing your disciform keratitis or a disc of edema in the stroma. And obviously, because there is no infection over here, and I have told you earlier that one type of keratitis you can use steroid, and this is the answer for that question. The only type of keratitis where you use steroids is the disciform keratitis, and the reason is that because it is an immunological reaction and not an infective condition. Okay, please remember this. It can be asked in your exam. The only form of keratitis in which steroids can be prescribed is the viral disciform keratitis. And of course, your true dendrites are formed in this condition. Let's look at the herpes zoster that affects the eye. We know that herpes zoster is the name of the disease, whereas the virus causing this disease is varicella zoster. Now we are familiar with this, that it causes chicken pox when we are young. Most of the children get chicken pox, and this virus remains dormant within the nerve roots, and whenever there is an immunological compromisation, this virus reactivates from its dormant state. And when it is occurring in a young patient, you should suspect a HIV in that patient. See, certain people such as the old people or those with cancer chemotherapy going on, they are obviously immunocompromised. However, if it occurs in a young patient, that is herpes zoster in a young patient, you should immediately think about HIV. Now, an important and very famous question, very frequently asked in your exams, is the Hutchinson's rule. Now look at this picture. What does this Hutchinson rule do? Is that it predicts whether the herpes virus will affect the cornea or the eye or not. In this condition, we call it as herpes zoster ophthalmicus. If the vesicle, that is the herpetic vesicle, is present on the tip of the nose like this, it indicates that the eye is infected as well, and that you have to treat the eye as well. This is the famous Hutchinson's rule. Why is it that? What is the relation between the nose and the eye? Because both the tip of the nose and the eye are supplied by the same branch of nasociliary nerve. Nasociliary, nose and your eye. So that is the reason behind Hutchinson's rule, and this condition indicates that you have to start the treatment within 72 hours of your diagnosis, and any failure to do this leads to a very painful condition. It is a very excruciating pain. It is called post-herpetic neuralgia. It occurs usually 1 or 2 months after the subsiding of the disease. If you do not treat within 72 hours, it leads to post-herpetic neuralgia. Okay. So another form over here is the nummular keratitis. By nummular, I mean coin-shaped. Please look at this picture. All of these coin-shaped opacities characterized the nummular keratitis seen in herpes zoster. Also here again, you're going to see pseudodendrites. Okay, these are how the pseudodendrites appear. Now, a few important points in your exam point of view. For a quick revision, pseudodendrites, we have learnt all these 3 conditions now. They are seen in herpes zoster, contact lens wearers and acanthamoeba. Pseudodendrites are seen in herpes zoster, contact lens wearers and acanthamoeba.